So today we are discussing about histology of epiglottis, histology of lip, histology of hard palate and histology of tongue. So coming to the histology of epiglottis, we know that epiglottis is a best example for elastic cartilage. Okay, so elastic cartilage means, first of all, we will discuss about some few points regarding cartilage. Okay, so we have three types of cartilages are present: hyaline cartilage, elastic cartilage and white fibrocartilage. So coming to the elastic cartilage, here the chondrocytes, they are arranged in groups. So the chondrocytes are inverted D shape, right? The chondrocytes here are arranged in groups. We call them as isogenous groups of chondrocytes. Okay, in the matrix we will able to see elastic fibers clearly. This is pink in color. Elastic cartilage appears in pink in color. Okay, so if we can see isogenous groups of chondrocytes in the matrix, as well as we can see elastic fibers. They are scattered among the matrix, and it is the elastic cartilage. It is covered by perichondrium. It is covered by a fibrous membrane called perichondrium. So epiglottis consists of a central mass of elastic cartilage. Epiglottis consists of central mass of elastic cartilage. Outside to that elastic cartilage, first of all, the first layer is the epithelial layer. Epithelium of the epiglottis is stratified squamous non-keratinized epithelium. Stratified squamous non-keratinized epithelium is the characteristic epithelium of the epiglottis, and also the lower part of the posterior surface of the epiglottis, it is covered by pseudo-stratified ciliated columnar epithelium. So epithelium, the epiglottis consists of two types of epithelium. The entire epithelium, the occupied here is the stratified squamous epithelium. A small part near the lower part of the posterior surface, it is covered by pseudo-stratified ciliated columnar epithelium. Okay, deep to the epithelium, we have a connective tissue layer is present, and this connective tissue layer, in the connective tissue layer, we will able to see some blood vessels are seen, as well as some mucous glands are seen. Mucous glands as well as blood vessels are seen deep to the epithelium. So the epithelium here is the, I have mentioned epithelium wholly, have drawn epithelium only in the upper part. Actually you have to draw the epithelium here also, the stratified squamous epithelium here also. We know that in the stratified squamous epithelium, what are the cells present in the stratified squamous epithelium? The basal layer consists of columnar cells, out to 3 to 4 layers of polyhedral cells, and outermost layer is the squamous cells. Okay, so that is the stratified squamous non-keratinized epithelium. So stratified squamous non-keratinized epithelium is seen in epiglottis, except in the lower part of the posterior surface, the epithelium, whereas that is nothing but pseudo-stratified ciliated columnar epithelium. Okay, next one is, deep to the epithelium, we have mucus, we have connective tissues present. In the connective tissue, we will see some fibroblasts cells, macrophages along with blood vessels. We will see mucous acini, mucous glands are seen. We know that what is the structure of mucous acini? The mucous acini consists of large lumen, and the cells are cuboidal in shape, and the nucleus is flattened and is situated at the base. So that is the mucous acini structure. Mucous glands are seen. Mucous acini together they give rise to mucous gland. So, and in the central mass we have elastic cartilage is present. So what is elastic cartilage? Elastic cartilage is nothing but what consists of elastic cartilage? Elastic cartilage consists of isogenous groups of chondrocytes along with elastic fibers in the matrix surrounded by the perichondrium. And here the chondrocytes, they are arranged in groups. This is called capsule. This is called capsule. The matrix which is present around the chondrocytes, it is thickly stained. We call it as lacunar capsule, or otherwise called it as territorial matrix. And the matrix which is present in between the two isogenous groups of chondrocyte, it is lightly stained. We call that matrix as the interstitial matrix. So what is the shape of chondrocytes? The shape of the chondrocytes is inverted D shape. So epiglottis consists of a mass of elastic cartilage. It is the best example of elastic cartilage, and the epithelium here is stratified squamous non-keratinized epithelium, but a small part in the lower part of the posterior surface, the epithelium is pseudo-stratified ciliated columnar epithelium. Okay, so that's about the epiglottis. And coming to the lip. So, coming to the lip, we know that lip has external surface covered by skin, and this is the mucocutaneous junction. Here is the mucocutaneous junction, and this is the mucosal surface. Mucosal external surface and internal surface. The external surface is covered by skin, and the internal surface it is covered by the mucous membrane. On the external surface, we have hair follicles are present, sweat glands and sebaceous glands are present, and the internal surface we are divided of these glands. Okay, so coming to the lip. So this is the lip on the external surface, and this is the mucosal surface. So here it is covered by skin. We know that the epithelium of skin is stratified squamous keratinized epithelium. Here the epithelium of the mucous membrane is also stratified squamous non-keratinized epithelium, but here is the epithelium is very thick, but that means the layers of cells are very thick in mucosal surface. Mucous membrane surface, the internal surface, here the epithelium is very thick. Towards the skin, the epithelium is thin. Here on the mucosal surface or mucous membrane, where mucous membrane is present on the internal surface, the epithelium it is very thick. Deep to the epithelium, we have the connective tissue layer is present. In the connective tissue layer, we will able to see mucococinae and blood vessels. Mucococinae and blood vessels are seen in the connective tissue deep to the epithelium. And one more thing is, the lips consists of muscle layers. Lip consists of skeletal muscles. So we can see in the center a longitudinal sections of skeletal muscles are present. Longitudinal sections of skeletal muscles are present deep to the connective tissue layer. So that's about the lip. So the lip consists of external surface and internal surface. So deep to the skin we can see the hair follicles here, because this is the external surface which is covered by skin. That part of the lip consists of sweat glands, sebaceous glands and hair follicles are present. So we can see the hair follicles deep to the skin. And here the epithelium is very thick on the mucosal surface, and the mucous membrane consists of very thick, very dense epithelium. That means the layer of cells are more. And deep to the epithelium we have mucococinae and blood vessels which are present in the connective tissue, and muscle layer is present. Nothing but the skeletal muscle layer is present in the lip. So that's about the lip. And coming to the hard palate. So we know that the hard palate it is formed from the primitive palate as well as the palatal processes of the maxilla. The hard palate is formed by the premaxilla as well as the palatal processes of the maxilla, and the anterior two-thirds of the hard palate is ossified and it is called hard palate. The posterior one-third remains soft, we call it as soft palate. And the epithelium here in the hard palate is the stratified squamous non-keratinized epithelium. Stratified squamous non-keratinized epithelium. And deep to the epithelium we have a dense muscle layer, dense collagen fibrous layer is present. Sorry, not muscle layer. We have dense collagen fiber layer is present in the lamina propria. So deep to the epithelium we have dense collagen fibers. Dense layer of collagen fibers are present. More and more number of collagen fibers which are running in bundles are present deep to the epithelium, that is in the lamina propria. Along with the collagen fibers, we will see some fibroblast cells are seen, and the macrophages and some blood vessels are also seen. And here deep to the lamina propria we have submucosal tissue is present. In the submucosal tissue we will able to see mucous glands. In the submucosal tissue we will able to see mucous glands. So mucous glands are present in the submucosal tissue along with some nerve fibers and blood vessels. So first and the remaining layer is the bone, and the remaining part is the bone because the hard palate is ossified. That's why the remaining part is the bone. So four layers are present. First layer is the epithelium. In the epithelium with the stratified squamous non-keratinized epithelium, and deep to that we have here, look here, we have bundles of thick dense layer of collagen fibers are present, and here the collagen fibers are present. Deep to the collagen fibers we have submucosal tissue is present which consists of mucous acini, and deep to that bone is present. So that's about the hard palate. And coming to the tongue, we know that tongue is a muscular organ. Tongue is a muscular organ which helps in speech, deglutition, everything. Tongue is a very important conical muscular organ. So when we take the section of the tongue, we know the tongue consists of papillae, right? Tongue consists of papillae. What are the papillae present in the tongue? We have filiform papillae which are distributed all over the tongue. Which are distributed over the dorsal surface of the tongue. Okay, that is called filiform papillae. And the fungiform papillae, they occupied the tip as well as the sides of the tongue. The fungiform papillae. And the third one is the circumvallate papillae. Circumvallate papillae, they occupy in front of the sulcus terminalis. These are the circumvallate papillae, are large papillae. They are present in front of the sulcus terminalis. Okay. So, in the tongue, in the section of the tongue, we will able to see all the three papillae. Okay. So, when we take the structure of filiform papillae, it appears like this conical part. It appears like a conical projection. Okay. So, usually the epithelium of the tongue is stratified squamous non-keratinized epithelium, but the tips of the filiform papillae, it is keratinized. The tips of the filiform papillae, it is keratinized. Okay, the epithelium is straight. So, this is the filiform papillae, and here this is the fungiform papillae. Fungiform papillae are comparatively broader when compared to the filiform papillae. And next one is the circumvallate papillae. Circumvallate papillae are very large papillae. They are present, they have trench and wall is seen. Trench means they are present in a circular groove, that is called trench is present here, trench. And wall is present here, this is wall. Trench and wall is seen in circumvallate papillae, and also it consists of the epithelium here is stratified squamous non-keratinized epithelium, and the circumvallate papillae consists of taste buds. The circumvallate papillae consists of taste buds along with the epithelial cells. The wall of the circumvallate papillae consists of taste buds. So, we have three types of papillae seen in the tongue. Filiform papillae, the tips of the papillae, it is keratinized, and fungiform papillae and circumvallate papillae are large papillae where trench and wall is seen. They are dipped into the wall. We can see the wall of the circumvallate papillae, and this is called trench. This is the groove called trench, and the wall is present in the circumvallate papillae. And taste buds are present in the circumvallate papillae. The circumvallate papillae, they are 10 to 12 in number, situated in front of the sulcus terminalis of the tongue. Okay, and deep to the epithelium in the lamina propria, we will able to see more number of serous acini. So, serous acini, what is the structure of serous acini? So, serous acini consists of small lumen, and the cells are pyramidal in shape. Nucleus, it is rounded and situated at the base, and the apex of the cell consists of more number of zymogen granules. So, that is the structure of the serous acini. We will able to see more number of more number of serous acini deep to the epithelium in the connective tissue of the tongue. So, serous acini glands, we call it as von Ebner's glands. We call them as von. These acini are nothing but, serous glands are nothing but von Ebner's glands. Okay, and we know the tongue is made up of skeletal muscle. That means that we are able to speak. That way we are able to chew the food. We are able to deglutition of the food takes place because the tongue is made up of skeletal muscles. So, in the deep to the von Ebner's gland, deep to the connective tissue layer, we can see the different directions of the skeletal muscle fibers are seen. We know that the skeletal muscles are nothing but the cylindrical muscle fibers, where we can see the transverse striations are seen in the skeletal muscle layer, and along with the transverse striation, we can see at the periphery we have seen multinucleated condition called syncytium is seen in the skeletal muscle layer. So, this is nothing but the skeletal muscle. This is nothing but the skeletal muscle, which are in different directions. So, that's about the tongue. Tongue consists of papillae, filiform, fungiform and circumvallate papillae. The tips of the filiform papillae, they are keratinized. The epithelium is stratified squamous, non-keratinized epithelium, but at the tips we can see the keratinized epithelium at the filiform papillae, and the fungiform papillae, they are situated in the front as well as the margins, and here some taste buds are also present in the fungiform papillae. And next one is the circumvallate papillae. They are very large papillae, trench and wall of seen, trench That means depressions are seen, French groove is seen, and walls is seen, and the wall of the circumvallate papillae, they consist of taste buds. They are present, they are 10 to 12 in number, they are present in front of the sulcus terminalis, and deep to the epithelium we have one epidermis glands are present, nothing but the serous acini, and deep to that we have different directions of the skeletal muscle layer is present. So that's about the tongue. So these are the about epiglottis, lip and hard palate and tongue. Here we can see one common point is the epithelium here is the stratified squamous non-keratinized epithelium is seen in all these 4 slides. Okay, so how can you identify epiglottis? By thick mass of elastic cartilage. How can we identify lip? Means on the mucosal surface the epithelium is very thick, and we can observe submucosal, we can observe mucous acini, nothing but the submucosal glands are present in the connective tissue. And how can we identify this hard palate? Means dense layer of collagen fibers are present deep to the epithelium, dense layer of collagen fibers are present in the hard palate. In the tongue, the most important characteristic feature is the presence of papillae. So that's about the histology of epiglottis, lip, hard palate and tongue.